A lot of my patients have been asking us about peptides and what those are as compared to hormones. And peptides are strings of amino acids that aren't big enough to be a protein. We all know that proteins are made up of amino acid. A peptide is something that also contains amino acid but doesn't reach the same size as a protein. These peptides are signaling molecules in the body. So like hormones, they also send messages to different areas of the body and different cells to do different functions. And there are probably over 7,000 peptides in the body. They allow for us to really target and personalize treatment options based on what a patient's individual needs are. There are peptides that affect growth hormone release. There are peptides that affect libido and sexual function. There are peptides that affect how your body uses insulin and decreases insulin resistance and appetite, helping with weight loss. And there are peptides that help with the immune system. So many of these are given by injection or nasal spray versus by a pill or a supplement. However, they can be quite helpful in customizing a health plan for a patient. One of the most popular peptides that people are using right now involves the peptides that help with growth hormone release. So we all know that growth hormone in adults is a repair hormone. It's what heals and repairs our tissues. It's also good for energy and sleep and hair and skin and nails and anti-aging. However, there are certain risks with giving straight growth hormone because you're kind of overcoming the body's own production and feedback mechanisms to say, hey, we have a little bit too much of this. We can use peptides to help with hormone release because there are several peptides that act as growth hormone releasing peptides. And those include sermorelin and CJC 1295. And these peptides are injected. Depending on the type, it might be 5 days a week or it might be every day in the evening before bed. And they can help your body stimulate your own pituitary gland to make a little bit more growth hormone. In addition, these are given with ipamorelin, which acts like another hormone called ghrelin in the body, which also helps to release the growth hormone from the pituitary gland. So these can be very helpful in boosting your own growth hormone production over time. Some of the benefits of the growth hormone releasing peptides are seen over really the first 4 to 6 months that you take it. So early on in using the growth hormone releasing peptides, sermorelin, ipamorelin, and CJC 1295, the first thing our patients notice in the first week or two is improved sleep. They notice that they're sleeping longer, deeper, feeling more refreshed, waking, getting up less in the middle of the night. The next thing that they notice over the next 3 or 4 weeks are some of the anti-aging benefits. Maybe wrinkles aren't as deep, hair quality's better, nail quality's better, maybe even some better energy. In addition, after a month or two, some have noticed increase in libido and better sexual function. And finally, in that 4 to 6 months range, we can see changes in body composition with better muscle mass as compared to fat. So there are a lot of benefits that can accrue over time from using some of the growth hormone releasing peptides. One of the most popular peptides that we use is semaglutide or semaglutide. And this also comes as a regular prescription drug called Ozempic, but often that is only indicated for people with diabetes. However, we can compound an injectable form of semaglutide that is a once-a-week injection that helps to normalize insulin release. So it increases the insulin response to a meal to keep the blood sugar under better control, but it also has effects on slowing down how fast the stomach empties. So people will feel more full sooner and stay full for longer. In addition, it works in the brain to help the brain signal to the body, hey, we are full, so that it's harder to overeat. And over time, in combination with a healthy diet and exercise routine, on average, patients can lose up to 15% of their body weight.